An ongoing cultural myth about pregnant women is that they should eat as much as they want. But research indicates that's simply not true, and that a moderate diet during pregnancy is much healthier for the mother and child. Now, an innovative program at Northwestern University's Feinberg School of Medicine is taking that idea one step further, helping overweight women manage their diet and exercise, and learn to do so when they're expecting.
The work that we're doing here with you today and throughout your pregnancy is not only for your health, but also for your babies.
Dr. Lisa Neff is starting a class for pregnant women at Northwestern's Prentice Women's Hospital. This is a group trying to break some habits, and not just their own.
In past generations, there wasn't as much attention paid to how much weight a woman was gaining during pregnancy. And in fact, many women were encouraged to eat as much as they wanted and to eat for two, without regard for their weight gain.
But these women want to do something different. They've enrolled in Healthy for You, Healthy for Two, a program at Northwestern designed to manage weight and exercise during pregnancy. We caught up with Ansonia Padnia, the mother of a 2-year-old, just a few weeks before her due date. Because of medication Ansonia took to manage Crohn's disease, she had heavy weight gain during her first pregnancy and wanted help.
During the last pregnancy, I just felt like I was not as healthy. It was a burden to carry around the extra weight.
I was in the program from the very beginning. I think I was only like 8 or 9 weeks pregnant when I started.
Megan Reisky is a recent graduate of Healthy for You. Her daughter Amelia is 2 months old and doing well. But at the onset of her pregnancy, Megan didn't want to have an even harder time losing weight after Amelia was born.
That makes sense. Why am I eating so much extra just to throw it in my thighs if the baby doesn't eat it?
Since the program began in 2009, about 200 women have enrolled. Monthly sessions focused on balanced nutrition as well as exercises that will help, not hurt.
Good. Inhale on the way up. Keep your chest lifted and your heart up.
Dr. Robert Kushner is the director of Northwestern's Comprehensive Center on Obesity, which oversees Healthy for You. He says research has established clear links between obesity and a number of medical problems, such as diabetes, stroke, fatty liver disease, and cancer. But now, Dr. Kushner says there's a greater understanding about the connections between obesity and pregnancy.
If the mother is excessively overweight during pregnancy or gains an excessive amount of body weight, before the child coming out of the birth canal takes his or her own first breath, that child already has an increased risk of getting diabetes, heart disease, or obesity, simply because of the environment that the fetus or the child grew up in during pregnancy.
Have a seat.
For Ansonia Padnia, her husband Ashish, and their 2-year-old daughter Sahana, the program has had a big impact at mealtime.
I learned a lot. There was a lot of myths on what not to eat. So I learned, okay, some of these foods are safe, these other foods are not as healthy, and I definitely put that into practice at home. Good job.
All right.
In the first pregnancy, I gained 45 pounds. In this pregnancy, I'm 3 weeks from delivering, less than 3 weeks actually, for my due date, and I haven't even gained 20.
The challenge is not just to manage weight during pregnancy, but after it too. Megan Reisky and her husband Nick are both trying to lose weight. That includes going for walks with their baby Amelia in the stroller, not to mention their loyal dog Lily. Meanwhile, Nick, a culinary instructor, is making lower-calorie meals. For the Reiskys, these changes represent something meaningful for both generations.
If I could help give her those tools or help setting her metabolism off right, well, she was with me, then that's what I wanted to do. I wanted to give her a better chance at not being overweight as she got older.
Squat, pull back. There you go.
Doctors at the program say anecdotally they're seeing a difference, that women in Healthy for Two are getting through pregnancy with fewer complications and better outcomes. But the next step is to take part in formalized research.
What we do know is that gaining excessive amount of body weight during pregnancy or being obese during pregnancy is not healthy for the mother or for the baby. We know that. What we're trying to learn is how do you intervene and does that make a difference? That is what Healthy for You and Healthy for Two is all about.
Great job, guys.